Here at Gough Surgical, we offer minimally invasive, muscle-sparing, robotic-assisted surgery. But what that basically means for my patients is a faster recovery time, less pain after the surgery, more accurate placement of my implants. My goal since I started practice was to be able to take my patients who want to be active and get them back to this active lifestyle with minimal downtime, minimal pain, and the least amount of recovery time as possible.
I had this knee replacement done 8 days ago. It was just a quick in and out. I felt like, I was in it at 8 o'clock. The surgery was about 9:15, and I think I was out at 12.
I think advanced recovery techniques are critical in hip and knee replacement. And at Gough Surgical, that's what we definitely offer. These range from muscle-sparing surgeries, minimally invasive surgeries, and robotic assisted surgeries. I'm excited to offer my patients muscle-sparing, robotic-assisted knee replacement. Here at Gough Surgical, we don't cut any muscle at all. Our patients, because of this, are able to walk within a few hours of surgery. They're able to go home the same day.
I'm walking without a walker, and I haven't had a lot of pain. The most I've taken is extra strength Tylenol.
Almost all of my patients take no narcotics after surgery, and their pain is mostly controlled with Tylenol. They're able to do all the things they want to do, whether it's playing with their grandchildren, or hiking the Grand Canyon, or even winning a world championship on their bicycle.
This is my World Championship cycling jersey, and this is basically the embodiment of the past decade of work that I've put into it. And without Dr. Gough's procedures that he worked on me, none of this would have been possible. So I've had a total hip replacement in 2014, which was my first one with Dr. Gough, and then in 2019 we did my total knee replacement. Getting these surgeries allowed me to maintain that super high level active lifestyle where if I didn't, I was just going to go the other direction.
I'm excited to offer my patients who undergo hip replacement a newer minimally invasive technique called the direct superior approach. It offers our patients a quicker recovery, less muscle damage, almost no risk for dislocation after the surgery, and faster recovery. Okay, so I'm going to take you guys through a robotic knee replacement that we used during surgery. So here's a knee that we have that's to simulate a real leg. We basically hook the patient up to sensors, which is what you can see here, and the robot then can visualize this and see the leg in space. The robot will capture the values, and then I'm able to actually adjust the implant based on these values to fit this particular leg, perfectly. We can actually tailor fit the positioning of this implant to the patient. And this robotic arm actually comes into the field and cuts this bone for me. And the beauty of it is it actually won't let me cut something I shouldn't cut. Here at Gough Surgical, each patient feels like they're part of the family, and communicating with our office is not an issue. We have cell phones for every provider in the office, and each patient is provided this information. So there's never an issue with communicating with us, and I truly believe this helps in their recovery process, knowing that if they have an issue or a question, they can get a hold of us at any time and put their concerns at ease and get back to their active lifestyle, which is what they're looking for.
Getting the proper treatments, getting a great team behind me to help me recover was as important as the surgery itself.
Our complication rate is extremely low, our infection rate is extremely low, and our patients' recovery is simply astonishing.